Hi, I am Hari Subramaniam, Director LS Devices, who owns the brand LifeSigns. We are into remote patient monitoring. Few years back, patient monitoring was largely manual. The nurse was the only person who was able to, in timely intervals, she used to go and check on the patients. And if the nurse is very skilled, by looking at the patient itself, she's able to kind of identify if there's any issue. And she uses multiple devices to find out where are the parameters standing, how the vitals are there. Any manual work, it's prone to some errors, and most of the vitals are checked during intervals, depending on the patient condition. Now, we do continuous monitoring, whereas the patient will be monitored through IoT devices continuously. All the vitals are monitored continuously. Of course, new technology, always there will be a lot of challenges because people have to understand the technology. And in this case, the nurse has to understand the technology, and nurse has to start feeling that this is more to help her or him than it's coming to replace them. Because that's the first challenge we always face when we go to a hospital, when we go to any paramedic or anywhere, they feel that technology has come to replace them. Technology has actually come to make their work much more efficient, much more easy. There are a lot of IoT devices, new technology software has come. Now we are in the phase where they are a bit confused because every day there is something new coming up. So they have to try, test, then only they can take a call because it's a call of life and death. So that's the second challenge, but we have to come over. There's no other choice unless they have to experience it and come over it. Opportunities, yeah, huge opportunities today. I will say huge opportunities because we were running with, say, we are a country of 1.4 billion people, and our infrastructure, we're just building infrastructure. I think we will jump the gun and we will go to the next level, how we did in UPI or mobile technology. We will go to the next level in healthcare, where using multiple devices, best software possible, and the connectivity, I think there are plenty of opportunities. Today, a doctor sitting anywhere can see the patient who's anywhere else in India and can give his advice. Intelligence can be used efficiently. It need not be close by, one. Number two, apart from that, we also give real-time data, which is very, very important. Opportunities are plenty. Our intelligent ambulance, why we call it intelligent? It's just not, ambulance is no more just taking on patient from point A to point B quickly. Ambulance has now become more intelligent, meaning it can provide more data while it's on the move to the clinician, to the hospital, to the paramedic while it's on the move. So which is possibility, and today we have come to that. That's a reality. Meaning, one point, say eventually the ambulance itself will be operating like a clinic with all the devices, technology there at the doorstep of the patient, which can give more information to the doctor who's sitting elsewhere. And during movement, you don't miss the golden hour. And any intervention also is possible today, thanks to technology, thanks to intelligent ambulance. Yeah, today we have the technology to monitor a patient uninterrupted continuously with a very few seconds, minutes latency, which I feel is the greatest watershed moment in healthcare today, because today clinicians, doctors, nurses are able to get data continuously, even without a few seconds interruption, without any blind spots or black spots. They're able to get data which they get more and more. So what we have seen in the hospitals today, some hospitals claim that there's no code blues in the hospital. There's no readmissions into ICUs bring down. How it happened? Because the continuous data flow, with an algorithm which can give and analyze data, so you will know that the patient is heading towards something which they can avoid, which is, I think, very, very important, because most of our healthcare spend is towards infrastructure which is built to a patient which is already, the patient is deteriorated or patient is already in a critical condition. If we are able to give uninterrupted data, this can be avoided. So your large spend on healthcare can be avoided. It's more preventive than cure. So before that we started, I can say COVID came as advantages and disadvantages. Of course, COVID was a disadvantage, but mobility, we couldn't travel, we couldn't see, we couldn't go into the hospitals because hospitals were, you know how it was during COVID. But other side, We went by road to most across India. We went to hospitals. The learnings has helped us today. What we are is because of the learnings what we had during COVID time, and the feedbacks we got from the hospitals, from doctors, from nurses, clinicians. So we had a big list of problem statements, pain points, and gaps we saw. That helped us today mature our product to such a level that wherever we go, nowhere in any hospital, whether it's government or a public hospital or a private hospital, a state-of-the-art hospital, nowhere our solution is rejected or reviewed. They like it because what we have learned that last 3 years during COVID has helped us a lot to bring the product to this level today. We started with the monitoring patients in the hospital. Today, when we started doing critical patients because that's the first level of test we want to pass, and that's like an IIT test. So we passed the test. So now we have started now managing wards, like we are spreading into all inpatient monitoring in the hospital. And from there we went to the next step where our solution can be used in OT also during procedures and operations also it can be used. From there, next level, now we have started going home after the surgery is performed, post-surgery. From post-surgery, we now have matured to go home with the patient, meaning the patient will be monitored at home also. Till everything is fine, the hospital can monitor the patient. That side. Other side, we have now today started intelligence ambulance where the patient will be monitored from the time he is being picked up or the time the hospital people meet the patient. From that point, we will be monitoring patients. So we are covering the full spectrum from the point we pick up a patient in hospital, during surgery, post surgery, and at home also. So that is one. We have now covered the entire spectrum of monitoring patients. One. Second is we started monitoring critical patients. Now from there we matured to monitor except pediatric patients, rest of all the patients we monitor today. The use cases, we have use cases in cancer care, in neuro, in the hospital, various divisions of the hospital. We do give care except pediatrics. Below 10 years, it's a very strong biosensor, so we don't advise for children below 10 years. Rest all we do. Now we have started looking at using the biosensor for children also. And we are now coming up with solution for fetal monitoring.